So the title of the talk is Realist Evaluation and an Architectural Understanding of Health and Social Programs. So this idea of architectural understanding is what I'm focusing on here. I'm using it somewhat metaphorically, but hopefully this will become clear. So the first point that I will discuss is, why do we need an architectural understanding of health and social programs? Then I want to talk about the idea of social contingency as a design feature of health and social programs. I'll talk about realist evaluation very briefly. This is not an introduction to realist evaluation, but I will introduce some key points from realist evaluation. And specifically, I will just touch upon this idea of reusable middle-range conceptual platforms. So reusable conceptual platform is a concept that has come from Ray Pawson's work. So it's a brilliant idea, and I think this is a good forum to develop it further. And carrots, sermons, and sticks. I don't know if you know what that means yet. So if you don't know, I'll explain that. Maybe you've heard of that before. Carrots, sermons, and sticks as a beginning, as a starting point in the conversation of developing a taxonomy or a classification of interventions. Maybe that's just the beginning, and we can find different ways to classify and understand interventions in terms of a design perspective, an architectural design perspective. Okay, so that's basically what I will be talking about. So why do we need an architectural understanding of health and social programs? So I'm providing 4 reasons here. There may be more than 4 reasons. You may come up with more. But the first one is that every initiative, so for example, policy, program, intervention, service. So I'm saying the word initiative because there are so many different ways in which policies, programs, services manifest. But what I'm really talking about is an effort, an action, an effort to create some positive change. So every initiative has a design, regardless of whether or not that design is made explicit and whether or not it is ill-conceived or highly functional. So that's the starting point here, which is to say that every action we can theorize in terms of its design. What is it designed to do? What are we trying? If it's an intentional action to create change, what is the underlying design of that? And sometimes it's very obvious, and other times it's not so obvious. So that is a lot of the work of realist methodology, is understanding the design of a program that you're studying, and that's when we bring in the idea of program theory and middle range theory. Here I'm using the concept of architectural understanding, but in practice it often looks like program theory, middle range theory. The second point is that it is difficult to gain an understanding of the complexity inherent in the implementation of policy design in context. Using an architectural metaphor helps to shed light on the blind spots in our thinking. So what I'm saying there is that, programs are complex, environments are complex. So when you have a complex intervention, a complex program in a complex environment, you have a lot of complexity. So if you're just going in blind to try to make sense of that complexity, that layered complexity, it's very difficult. And we inevitably end up with blind spots. We miss things. We're not really seeing the totality of the interaction between the initiative with its environment. And so the idea here is that starting from thinking about an architectural design understanding as a metaphor, we're not really talking about architecture in terms of the discipline of architecture, but it's a metaphor, will be a starting point for really seeing where we're not seeing, what we're actually not looking at. Which maybe is controversial in some regards. Somebody may say, oh, well, you're imposing a lens on your view of reality, so how do you know your lens is not biasing you? And yes, that is absolutely true. But what I'm suggesting is that actually your lens can help you see deeper and more clearly into the nature of complex reality. And that's a debate point, and that's something that we need to continually discuss. Does that make sense? Are our theories, do they bias us on only a certain way, or do our theories allow us to see things more comprehensively? It's a discussion point. The third point is that studying the design of one initiative helps us develop capacity for understanding design issues in other initiatives, different and similar. So you might start with looking at, in your work, so all of you probably have some research area. If you think of an intervention or a policy or a program in that area, you may start to uncover the structure, the design structure of that. And once you start doing that, you're sensitizing your thinking to that, which helps you understand the design structure in very different areas as well. So it's a capacity building process, which can be incredibly beneficial. And finally, focusing on design features of socially contingent programs gives us constructs for new thinking on innovating initiatives to resolve complex problems. Okay, so here I'm introducing the concept of social contingency, and I'm going to talk about that a bit more. But what I'm saying here is that if you focus on the design features of social contingency, it opens up a language. We start talking about things in a way that is perhaps different than how we may have talked about it before thinking about the design of a socially contingent program. And that opening up of that language also potentially may lead to an opening up of creative thinking around problems and innovation around problems. So those are my 4 reasons why I think an architectural understanding of health and social programs is beneficial. So I want to talk about this term social contingency. Okay, this Pawson and Tilley write about social contingency. It's written about in Realist Methodology, and it's also something that you may find a concept outside of Realist Methodology. So, but specifically I'm talking about social contingency as a design feature of health and social programs. So not social contingency like generally, but specifically as a design feature within and when I say programs here, I mean, the full spectrum of initiatives, programs, interventions, services, policies. Some people evaluate, say, guidelines, or some people evaluate something like an ethos of an organization. All of that has some intention for change. So the question is, what is social contingency in that context? So this is the definition that I'm providing here. So in the context of programs and policies, social contingency means that the functioning of an initiative relies on human agency or human-to-human interaction or some form of psychosocial, logical, or emotions-based decision-making. It's essentially saying that there is a human element to the functioning of a program. The program relies on a human decision-making process, communication between humans, or some feeling that somebody has, or a rational decision-making. Something in the spectrum of human experience is that the intervention is reliant on that for its functioning. Now that is a principle that comes from realist methodology. So I am, in a way, reiterating that. So Pawson and Tilley's work has influenced this, this idea that I'm presenting here. However, not all health and social programs rely on social contingency for their core functioning. Okay, and I'm going to give you an example. In a few slides, I'm going to give you an example to really explain that you can have a social policy with social contingency as well as a social policy without social contingency at the core level of functioning. Okay, so I will explain that in a bit. I just want to speak a little bit more about what I mean by social contingency in terms of the architecture. So social contingency, the architecture of social contingency means that the relatively intangible human aspects of social contingency, so trust, support, motivation, fear of consequence as examples, serve as the real substrate of programs. This is the actual material of programs. If you take the architectural metaphor, architects use building material, and in a way, for social programs, this is the equivalent of building material. Things like trust, things like support, and feelings like a feeling of motivation or a fear of consequence. These are building blocks and not just satisfaction scores. So if you did an evaluation and you frame these things as how satisfied somebody is with a service or a program, that's not what we're talking about. We are actually bringing that idea of patient or participant satisfaction. In the content of that satisfaction is actually the material of the intervention itself. That is the idea here. So understanding this can help evolve our course blueprint. So you might have a logic model which might be like a course blueprint, which shows sort of inputs and outputs, the ingredients that go into the components, the strategies that go into a intervention. But here we can use the idea of social contingency to uncover blind spots in understanding how the finer details of a program's architecture can have profound effects. And so a lot of times what I see is that you start at some level of vagueness about the program's functioning, its components and how it functions, and getting more and more detail about how the program functions at that socially contingent level is the answer to understanding how it worked, if it worked, and then whether it's the right intervention for the right context or if it needs to evolve, etc. And illuminating blind spots in our thinking is an important step toward program innovation and the gradual or sudden resolution of complex entrenched problems. Okay, so this is the whole idea here, is that we need to, identify our blind spots and then actually turn those blind spots into places where we're actually seeing what is actually going on. Okay, and specificity. So here talking about the detail, it's another way of saying the specificity of design. And here's a quote from an architect, Matthew Frederick, from a book, 101 Things I Learned in Architecture School. He says, the more specific a design idea is, the greater its appeal is likely to be. And I thought that really had a lot of resonance with the kind of discussion I'm having with a lot of people doing realist evaluation who are starting to go deeper into understanding how programs work and realizing that actually when you become more thoughtful about every sort of detail of a program's components or strategies and what they are trying to accomplish, then you sort of motivate, you may end up motivating people to, really monitor the program at the practitioner level, at the implementation level, and start to really care about those details. And this is more and more important, especially working with, say, vulnerable populations, where their feeling of candidacy for a program is very volatile. At any moment, if somebody just gets a judgmental look, they just are turned off. This is not for me, or this is not safe. This environment is not safe for me, and the program doesn't have the success it could. But getting to the detail of the resources in terms of, say, trust, support, motivation, engagement, these things, if we really study them and build on them, build our interventions around them, then the idea is that we may become more successful in customizing our interventions to diverse contexts, including highly vulnerable contexts, which is where a lot of the complex entrenched problems lie. Another quote from architect Louis Kahn He says that architecture is the thoughtful making of space. So similarly, you know, our programs, our policy, the more thoughtful it is, the more successful. And we are making space in a way when we create social programs, we are creating a kind of a space, a new space. And how thoughtful that is will correlate to how successful it is. That's the idea here. So designing in idea-specific ways does not necessarily have to be prescriptive. So just because you're looking at the details, or you're thinking about details, that doesn't mean that it has to be locked down into details. It's just working at that level of details. There may be flexibility, there may be adaptation, evolution, but it's about the detail. That's what really makes a difference. And attention to detail, design detail, gives inspiration and ideas for adaptation that may not arise through vague policy description. And quite often what we have in the real world is a lot of vague policy description that, you know, maybe intuitively you sort of understand it intuitively, yeah, that sort of makes sense, you know, we would do that. But really when you break it down, like what exactly are we trying to do? What are we trying to accomplish here? Something like a seatbelt law, you know, everybody has to wear a seatbelt. You must do this, you know, or there will be a fine. So unpacking the decision-making process around that, even something as seemingly as straightforward as that, you might find that in the detail, there will be a lot of assumptions that you hadn't thought about at the start. And this is what happens when people do realist projects. They start off at a certain place, identifying the program's strategies and components. Once they start theorizing the program, they realize that there are so many assumptions in a given program that even the policy architects hadn't really thought of. So it can be a very interesting, very rewarding and productive process using realist evaluation to theorize programs and, you know, to sketch out the architecture of a program. So is it going so well so far? If you have any questions or you want to interject, you might, please feel free. Okay, so here I'll give you an example of social contingency. So the idea of social contingency as a design feature of health and social programs. The example is, say you have a road intersection. So on the road, an intersection that is well known for an above average rate of car accident. Okay, so everybody knows it's written up in the news. Yet again, there's another collision that's happened at this intersection because the sight lines and the cars, the vision, the drivers can't see around the bend, and et cetera, et cetera. So now local planners could do a number of things to try to reduce the collisions, save lives. And so one thing that could be done is that they could decide to put a big sign, you know, a few hundred meters before the intersection to say, you know, please slow down, intersection ahead, you know, or dangerous intersection ahead, please slow down. Or you could put a new speed limit, which is like a legislative intervention. You could put a new speed limit saying people must slow down to, you know, 10 kilometers an hour as you're moving through the intersection. Okay, so that is one idea. Another idea is you could restructure the intersection. You could rip it up and put in a roundabout. You could widen the street so that because there's more space on the road, the chances of cars colliding is less. And the point I'm making is that the former involves social contingency, and the latter does not involve social contingency. You see what I'm saying? The former requires the driver to make a decision. The driver has to read the sign, has to feel the cautionary message, and you know, take it in and respond to it in a way that the planners hope that they would respond. Hopefully they won't speed up. Hopefully they will slow down when they read a sign saying caution, dangerous intersection ahead. But there is a socially contingent element there. It requires the human, engaged sort of human thinking to make the program work. The program wouldn't work otherwise. On the other hand, you have a restructuring of the intersection, which the driver might go through the intersection not having ever known that the intersection was restructured, and a collision was prevented, and nobody even knew that it was prevented because the cars passed by each other and they didn't hit each other. And so there's no social contingency. So you see that from an architectural design perspective, the idea of social contingency actually has a lot of relevance. Now somebody may say, well, okay, that's interesting, but you could argue that there needs to be decision making at the level of the local politicians to decide to change up the roundabout, right? So in that sense, that okay, well, social contingency is there because somebody has to feel the impetus, feel the motivation to change the intersection. But it's not social contingency at the core of the program. That's social contingency at the sort of periphery, or the uptake or the development, the motivation to develop such a thing. But at its core, at the core of the intervention, there is not social contingency in the example of reconstructing the intersection. Do you see what I mean? So that's why I included the word core at the core of the program, because ultimately all programs will have some form of social contingency because those programs and policies were developed by humans. So there is going to be some contingency, but whether there might be contingency just at the developmental stage, but the actual design feature of what gets developed may or may not have. Is that making sense? Yes, you have a question?
That's quite difficult to understand because say widening the road, people are going to react to that, aren't they? So they might drive faster, you might have more accidents. It's not the case that it's obvious.
Yes.
It's not socially contingent.
Yes, possibly. I mean, that's a very good point. I just repeat that point. So here you have a situation where you have this difference. So on the one hand, the first example I gave, you have a message, a communication to the driver where you're saying, please slow down. So there's a rational decision-making process there. Now, you're saying that if you widen the road, that social contingency is still there in a sense, but maybe it's not so conscious because now you see this road is so wide that you feel that you have this leeway to speed up. And then what happens in that case? Is the rate of accidents maintained or increased because people? But this is exactly the kind of discussion that we can have when we start thinking about social contingency. So there's some difference in those two types of social contingency, but maybe and this is how we can evolve the discussion. Yes. Yes. Yes, exactly. And public health is actually, it's a discipline that really does engage with both socially contingent and non-socially contingent, or, maybe there is still social contingency, but it's not of the direct sort of messaging type. It's like changing the built environment. Fluoridation of water source is another example. I had somebody come to my workshop once who was thinking about mechanisms as how people respond to resources, and she said, well, in my case, I'm just studying the fluoridation and the impact of water fluoridation on dental health. And so in that case as well, I mean, you might have a subgroup of people that are researching it and then deciding to use tap water or not use tap water based on the research. But generally speaking, there may be many people who are drinking tap water. One day it starts becoming fluoridated and they don't know, they have no idea. And the outcome of oral health changes, but not because of any decision making, not of any social contingency in that sense. So you see, that's another example of the difference in the design type. This is a very basic difference of design type. And then once you get into social contingency, you find that there are many different types of social contingency, and that's what we'll talk about. But one point I will make here is that if you're interested in Paulson and Tilley's realist evaluation, they have primarily designed their methodology around socially contingent interventions. So the definition of mechanism from Pawson and Tilley is around social contingency. That's not to say that that realist principles don't apply to non-socially contingent interventions, but the definition and the way you might engage with that, it might require some adaptation of the methodology, an adaptation definition of terms. Okay, it's good comments. Okay, so let me just talk a bit about scientific realism and realist evaluation for those of you who may not be familiar. This is not necessarily an introduction per se. There are other resources, including resources on my website where you can access just to get a basic introduction. But I just put a few thoughts down here. So scientific realism is the paradigm that realist evaluation sits in. And you might define scientific realism as the assertion that the world is real, irrespective of the fallibility inherent in the constructed conclusions of scientific inquiry. Okay? The world is real, irrespective of the fallibility inherent in the constructed conclusions of scientific inquiry. So there's a lot in that definition. What I'm saying is that realists, their starting point is to believe that all scientific inquiry, all knowledge that comes from science, has fallibility. It is prone to being not relevant or partial, so it's not telling the whole story. It's not possible for us to tell the whole story because the whole story is literally too complex and too vast for our abilities. So that doesn't mean that we can't develop pragmatic conclusions from science that can help us, but our knowledge is always vulnerable. It's always fallible. And it is constructed. So scientific knowledge, scientific outputs from science are always a social construction. That's something that we accept. And that this social construction is different. It's separate from what we see as reality, like the real. So this idea of a singular kind of reality that exists out there. And then the question is, what is our ability to really, really see that reality, really understand that reality for what it actually is. So if that resonates with you, then you'll find that the realist way of working and developing methodologically will have a natural flow to it. So scientific realism is to approach the activity of investigation with the goal of improving the alignment of what is real to our constructed understanding of what is real. So that is another way to understand realism, is to see the direction we want to go. Even though our knowledge may remain fallible and partial, the direction we want to go is to examine how well we may align our constructions of reality with reality itself. Now, what that actually means is a very good question. And there can be lots of debate around how you actually do that, and who really knows what reality is. We could end up going into a philosophical discussion, which is, I think, useful and productive, but maybe outside the scope of what I'm talking about today, because we will be focusing on the idea of evaluating programs. But this is part of realism, and realist methodology can be defined as an approach, so say evaluation, literature synthesis, that is customized to align the inquiry process to the needs of assessing complex reality. Okay, so it's an approach that accepts that reality is complex and that the methodology is now customized. It's becoming more sensitive to that complexity. So that's where we get the context, mechanism, outcome, configuration to try to account for this complexity. Okay? So realist methodology seeks to answer the questions: what works, for whom, under what circumstances, and how. So the idea is that programs are going to work differently for different people in different contexts over different time points. That's the starting point for realist evaluation, is that we're not expecting a singular sort of answer to the question, or to a question, does a program work or not? Our starting point is that it's going to be working differently in different contexts for different people under different circumstances and in different time points. So we are testing program theories through generative causation. So in other words, mechanisms. So if you've done any reading around realist methodology, you will know that it's focused on the idea of mechanisms, and that programs have mechanisms that serve to explain their functioning. So again, we're coming back to this idea of, architectural design, but specifically when we're doing realist evaluation, we are interested in mechanisms. And we can talk about that further. This is a diagram that is from this publication here, Realist Synthesis for Public Health, Building an Ontologically Deep Understanding of How Programs Work, for Whom and in Which Context. It's brand new, it's just come out. It actually is coming out in a few months, but it's available online. And this is adapted from Pawson and Tilley's realist causal framework that you can find in their 1997 book. So it's basically saying the same thing. It's just slightly depicted visually slightly differently, where we can understand that the context is like the backdrop. So it's like elements in the backdrop environment of a program that have an impact on outcomes. So things like demographics, or pre-existing legislation, or cultural norms, things that are part of the environment, things that are not part of the formal architecture of a program, but things that are in the environment. And when if you were to study architecture, you would also study your environment. Say if you were building a building, you would decide what materials to use based on whether it's the climate is primarily desert, or the climate is primarily rainy. You would change the building materials based on the environment. So similarly, in social programs, you may change the social materials based on the environment. That's the idea here. Now, mechanisms are now we're talking about socially contingent interventions. Mechanisms are resources offered through a program and the way people respond to those resources. That's Pawson and Tilley's definition. It brings in that human element. So the mechanism is very humanized. It's where a lot of the understanding of the human experience in programs comes from the mechanism. And so, interventions have all sorts of resources. They offer all kinds of resources, some of which are not even that obvious. So sometimes an intervention offers, say, a space to relax, a space to reflect, a safe space. That's not necessarily obvious at the outset if you're studying the intervention strategies, but you may theorize that this is what happens. Similarly, if you take the architectural metaphor, if you were to study architecture, and a really good architect might design a building structure where you enter the building, and the architect has designed it so that the entrance has a very high ceiling. It goes right up 3 or 4 floors. And it gives you a feeling, it gives you a feeling of openness, or just this expansive feeling inside. So even architects, in the traditional sense of architecture, they are interested in how people feel when they enter into buildings, engage in building design. Similarly, for social programs, it's the same thing, that we are interested in how people feel when they are engaging in a program. So, so again, the environment is going to create that. And then you have the strategy of the program, which creates the resources, okay? And then outcomes. So outcomes can be intended, unintended effects based on this context mechanism interaction. So, is it about the changed outlook? So you've made a change in your way of thinking. Service level uptake, so coming to the clinic more often. It's not any kind of decision making, a new feeling of community resiliency. Communities are galvanizing to take action and feel empowered. Health outcomes, so it could be clinical outcomes, clinically related outcomes, self-efficacy, social cohesion, social connections. There are so many types of outcomes. I mean, this is just a very limited list. Outcomes can be many, and it's not only the outcomes of interest, but also intended, unintended, expected, unexpected. Okay, so that's a basic sort of run through of the CMO configuration, the way Pawson and Tilley have defined it. And this, I know people have seen this before. This is something I show in my workshop, which is this iceberg to help us understand realist concepts of mechanisms, of ontological depth. So here we have an iceberg where you can, think of the area above the iceberg as the observable reality. So that correlates to the empirical. So this is, and what I'm saying here is that this is the result of underpinning mechanisms. So mechanisms underpin that reality, and that mechanisms generate the cause, are the generative cause of empirical reality. So that's the relationship between the observables and the hidden, and that mechanisms are latent until they're activated in conducive context. So that's another principle from realist methodology, that mechanisms get triggered. So if the context is right, if the context is conducive, mechanisms are triggered. So in the case of, going back to the case of the intersection on the road, maybe it's the case that in the context, in a small community, there have been many deaths because of the accidents. So that context triggers a mechanism of people taking the signboard very seriously because they have friends or family members who actually were injured in accidents in the intersection. They see the sign, that sign also triggers. So the context of previous accidents, the messaging is the resource, the context and the mechanism are working together to produce the outcome of interest, which is a reduction of speed going through the intersection. On the other hand, somebody out of town doesn't know anything about this intersection and doesn't have that. They don't have that context. So maybe the messaging doesn't fit with their context. If they are, coming from a context of a feeling of fearlessness and interest in reckless driving, that is their context. So the messaging doesn't trigger the response that the planners would like. So it's like that. It's the language of context and mechanism that opens up a whole discussion about how these programs work. And I'm introducing this concept of architectural understanding as just sort of building even just one step further from context mechanism. It's not in contradiction to anything Pawson and Tilley have said. It's just resynthesizing it in a different way in case that's helpful for people. Okay, so far so good. Yes, you have a question? Yeah. Oh, that's a good question. So if I understand the question is, if we think of mechanisms as latent, how do we distinguish the difference between a mechanism that exists but is latent versus a mechanism that doesn't exist at all? Fantastic question. So, but one could argue that if you're defining mechanisms in terms of how people respond to resource, specifically their response to resource, you may argue that there is a finite spectrum of somebody's response. Either they feel motivated, they feel demotivated, they feel like they love this resource, they're so grateful, or they hate it, they detest it, or they're neutral. They roll their eyes at it. It's just nothing to them. It means nothing to them. You might argue that there is that finite spectrum of mechanism responses that everybody has. Like the example I use in workshops is, say, you are trying to encourage people at the workplace or in the schoolyard to quit smoking, smokers to quit smoking. You might start with the idea that latent in the person is a desire to quit smoking that hasn't yet been activated. That's the idea. Now, if that doesn't resonate, if that doesn't really sound right, then there's a debate point there. But one may argue that in the realm of human experience, it's possible to gain a feeling at some point of a desire to change, to improve. Does that help? Yeah. Okay, so just thinking about this, about socially contingent programs. So understanding the building materials of socially contingent programs. So just as physical structures are built from physical materials like steel, wood, concrete. Remember I said architects, they will choose their building materials. Socially contingent interventions are built on social materials, which in realist language are mechanisms. So these are things, so it'd be very interesting for you to go back to your, areas of inquiry where you might think about this. What are the social materials of this, of the architectural blueprints of this program we are trying to understand? And this is where I come to this idea of carrots, sermons, and sticks. Okay, so this is from Pawson's work. So Pawson and Tilley have talked about carrots, sermons, and sticks, and other people have as well. And it's kind of an animated way of saying that there are, essentially three categories of interventions. But I'm curious to know, from your experience, if you see an intervention that doesn't really fit here. But the sort of the animation is that carrots are like the incentivizers. They're the interventions that are, giving something good, like something that people like, that people, want and are incentivized by. Then the sermons are about informing, so it's about education, teaching, preaching. Thou shalt do this, thou should not do that. You should make sure you, behave well. There's no threat per se, but it's just a caution, like, be good, do good things, don't do bad things. And deterring, which could be more about consequence. So, for example, in the incentivizing camp, you might have things like trust building, empathizing, respecting, caring, inspiring, relationship building, and other things like monetizing. Now, I put monetizing and technologizing in brackets because they often can be aspects of socially contingent interventions, but they themselves are physical types of resources, money and technology. For example, giving cell phones to agrarian farmers to pass on health messaging in a context of technology scarcity, for example. So there might be an incentive, to get this technology or to receive a certain amount of money, welfare systems, for example. There's an incentivization structure to that. And the sermons, so the informing, so this could be, through, for example, role modeling. So in role modeling, somebody may be, teaching somebody, telling somebody, talking to them, training, educating, upskilling, consciousness raising. So be aware of your situation. Poverty activists, for example, wanting to help people gain an awareness of things. So and cautioning, so preaching. The label on the cigarette carton, smoking kills. I mean, nobody's going to arrest you for smoking, but it's a caution. It's the sermon, smoking kills. So that would fall into that category. And then you have the sticks, which are the deterrents, which are about consequence. So it could be about prohibition, threats of consequence, reprimandation, punishment, so imprisonment, for example, or threat of imprisonment, or threat of a fine, or a legal case against you, or even it could be something like shaming. Somebody is a sex offender is put on a registered sex offender list and publicly known. So it's like a shaming type of intervention. So you see that there are definitely different types of interventions in terms of a categorization we may make. We may make a taxonomy of these interventions. And then what will be very interesting is to see, like, where are the gray areas? Where are the interventions that don't quite fit this? And sometimes some interventions have two things that go together. So they have an incentivizing and a threatening thing at the same time. Like, for example, a welfare system where it says, we will give you this money, but if you don't do this, we will take this money away. So there's a deterrence and an incentivization happening simultaneously. So, but see, you see the language that can open up here, the discussion that can open up from this kind of thinking. Yes?
I was just thinking about, so you can think of deterring as sort of the opposite of incentivizing, isn't it?
Yes.
And
Yeah.
the opposite of informing would be deceiving.
That's interesting.
Like that as well.
That's very interesting. I'll just repeat that. So the comment is that, incentivizing and deterring seem kind of like two sides of the same coin. If you're, the opposite of deterring is incentivizing and vice versa. And that informing, one might argue that the opposite of informing is deceiving, and that you might even have another category of interventions that are actually where the resources of the intervention is intentional deception. That's very interesting. Or confusing people. Do you have an example, just by chance, of an intervention that is like by design, designed to confuse people to achieve an outcome? You like to
saying that a lot of advertising is not about informing, but actually about deceiving.
That's true. That's true. Yes. Advertising, I mean, that is outside of the scope of health and social programming. But the point is well taken, because if you were to move this beyond sort of the goodwill of health and social programming, because obviously we're not going to spend money to try to make people more ill. So in the context of that, you have these. But the truth is that advertising can be seen as an intervention, and we can find the architectural understanding of advertising as well. And that's very, very important, actually. Very important. Did you have a comment?
I was actually going to say it's market design as a way of confusing people, but the way that our health service is at the moment, it's quite inadvertently confusing people.
Yes, that's true. So the comment, so the two comments was, one is like a supermarket design, say where you have all the bad food at eye level and the good food at beyond reach, or something like that, or all the organic produce just shoved in the corner, or something like that. The design of the layout may serve to confuse. Again, maybe that's not necessarily social contingency. Or if it is, it's social contingency that's working more at the unconscious level. But again, see, that's very interesting. We have to think about all these things. And the other point you were making is that, for example, was it the NHS service you said, or any service? A lot of times there is a lot of confusion, not necessarily by intentional design, but maybe by a lack of intentional design. The result is confusion. Would be fair to say? Yeah, very interesting. Yes, you had a comment? Oh, okay. Right. So if I understand now, so it's an intervention where you tell people that this resource exists when it actually doesn't exist. It's also similar to when you put a sticker on your window saying security, CCTV in operation, when there isn't actually CCTV in operation, but it serves as a deterrent. So those do fall under the category of deterrence, but it's a special category, isn't it? Deception. It's very interesting. It's very interesting. Okay. Yes. Yes. Yes, that's a very, very good point. And you articulated something that I was feeling about those words, trust building, relationship building, that I couldn't quite put my finger on. Because I was thinking they don't feel exactly like incentivizing, but they're not necessarily deterring, and maybe there's informing as part of that, like role modeling. So you see that some of this is crossing over already. And that's brilliant. That's exactly what I was hoping. This is, like I say, a conversation starter. So, this is definitely probably is the case that, in the case of, say, interventions to combat loneliness. So if the resource is to provide companionship to somebody who is experiencing loneliness, one may say that the relationship building isn't incentivizing, potentially, in that particular example. But in other examples where there is a relationship being built, maybe incentivization is not exactly the category that really explains it. So something that we have to think about. Okay, I just have a few more slides. So I just want to talk about this idea of the reusable middle-range conceptual platform. So Pawson talks about reusable conceptual platform. I've included the concept of middle range. So basically, you can think of middle range as meaning, a conceptual platform that may have applicability across many different types of interventions. And some design aspects are generic enough to apply to many different programs and sectors. So, for example, and this is sort of where, having spoken to so many people working in completely diverse sectors, talking to me about their intervention, and then I'm thinking, okay, this is sounding so much like the conversation I had last time with somebody else who was working a different intervention. So one example of what I'm talking about here is time-sensitive conceptual platforms. And what I mean here, the example I'm giving is, does a mechanism that triggers during a training period still fire in context after the training is complete? So a lot of interventions that I see, there is some kind of, either it's a training period or a intervention period that has a start and an end date, but the funders are not saying that we want the outcomes to end at the end of the funding, at the end of the program. There is a hope of sustainability. So what we see then from a design perspective, and using CMO configuration, is this idea that during the training, people have resources that are given to them, and if all goes well, those resources trigger a response. It could be a response of interest, of realization, of awareness, of feeling motivated, feeling comfortable, feeling like they want to change, and they may make those changes during the training session, or the mechanism may fire during the training session. But then what happens when they go back into their lives or back into the workforce? So sometimes it's an organizational intervention, sometimes it's a community-based intervention. What happens when they go back into their lives or their work practices? And what is it about the context post-intervention that may, in a way, erode the efforts of the mechanism being triggered during the intervention? Sometimes during the intervention, it's like a protected space where people can foster new feelings about certain things, new realizations. And then they go back out, and sometimes they maintain this, and then they create that sustainable change, or they have the awareness, but it doesn't lead to change. And then the realist analysis might expose that the context of the post-intervention, so the sustainability context, is too chaotic, or it doesn't have the supports. Maybe somebody has a chaotic home environment, or there's a lack of buy-in at work at the managerial level for what they had been exposed to and the mechanism that fired at the program level. So in that way, a lot of programs can be explained by thinking about this time-sensitive conceptual platform. Another conceptual platform might have to do with adaptability expectation. So if it's a policy or a program, is the policy highly prescriptive? In other words, that it's like there's a very strict protocol that this program has to adhere to, and it cannot veer off. You must adhere to exactly what this protocol says. Otherwise, it's considered, a violation. Or is the policy something that basically they're saying, we want you to make things change. We don't really care how you make the change. We want outcomes. We want to see the outcomes. But how you do it could be anything. It could be, it could involve any kind of intervention design that you think would make sense in your context. So this is what I see when I talk to many, many different people, that some people are working to evaluate programs that are very prescriptive, that are even scripted. A health professional, a nurse, for example, who is mandated to use this checklist once an hour, every hour, on rotation with patient visits, for example, as opposed to a mental health intervention where mental health workers visit clients in their home and say, ask them, how can I help you today? You know, what can we do for you that would make a difference for you and help you move forward? And then that could just be anything. It could be going out and purchasing, you know, some kitchen supplies. It could be going to a movie. It could, you know, so at that level, the design of the intervention is so starkly different. So this is why I say that it's so useful to think of the architectural design of your intervention at the outset as you're evaluating, if you're using a realist methodology, to think about these things as a way to clarify, you know, how are mechanisms going to fire? Do I have mechanisms that are applicable in the way Pawson and Tilly have described? Or is my intervention not a socially contingent intervention? So I just have some conclusions here, and then we may continue our discussion. So a few points. So one is that an architectural understanding of program and policy initiatives can help us better align evaluation methodology to the needs of complex reality. So that's my overarching point, that you may think of the architectural understanding and then proceed by creating your protocol in a way that is more complexity sensitive, so that you may be able to better capture the complex reality that exists out there. The second point is that this improved alignment, so the improved alignment between our evaluation methodology and the need for complex reality, this improved alignment can help us articulate a creative thinking process about innovative solutions to entrenched problems, because otherwise it's very difficult to come to solutions if we're not examining the detail of our efforts and the complexity of our problems. And a final word of wisdom from an architect. So this is from Matthew Frederick, from his book, 101 Things I Learned from Architecture School. He said, properly gaining control of the design process tends to feel like one is losing control of the design process. And I really resonated with that and appreciated that, because people who engage in realist methodology often end up feeling a lot of confusion in the process of gaining clarity. And I would say that's a very natural process. So, you know, if you do a realistic project and you don't have any confusion at all about anything, everything is crystal clear all the time, chances are you're not doing it right. So I'm giving you that because I know that my presentation was dense. There was a lot to think about. And this can result in a feeling of loss of control because, oh my God, there's just so much that we can theorize here. But actually, that loss of control is gaining control, because what you're doing is you're grappling with actual complexity, the nature of reality, which is inherently complex. We can't do anything about that. So it's better for us to tailor our methodologies to be sensitive to that than to reduce our complexity in our methodology, in a way whitewash the details of complexity, to try to handle something in more simplistic form. So that concludes my formal presentation, and now we will move on to what I was, more excited about, is our conversation. So thank you very much for your attention, and we can continue.